Evening all. We've got some Q's and A's going on this evening. Thank you all for joining me tonight. Each and every last one of you. I want to say thank you to my fans and my followers. Got some questions to be answered, so why don't we just see how we get on with that. If you've got a question that you would like answered, then what you can do is ask it. That'd be a start, wouldn't it? Whether or not you get an answer, who knows? But you never know till you try. That's what this person did, and look what's happening. They're getting an answer right now. Do we offer non-incision pinnaplasty? I'm sure I spoke about this the other day. I feel like I did anyway, but whatever. I'll talk about it again. No, we don't. So non-incision pinnaplasty is basically using a splint. So pinnaplasty is changing the shape of the ear, also known as prominent ear correction for people who have got prominent ears. And it is possible to correct a prominent ear without using surgery, by using a splint to splint the ear back and then holding it back. The problem with it is, because that sounds good, doesn't it? Avoiding surgery. We all want to avoid surgery if we can. Yeah, you heard me. We all do. I would avoid surgery, even though I'm a surgeon. I'm sure they'll always find things for me to do. But if something can be done without surgery, without risk, without complications, let's do it. I'm all for it. But we don't do it because it only really works in newborns. So in very young children, the cartilage of the ear is still quite supple, and so you can correct a prominent ear with a splint. They used to, I don't know if this still exists, a thing called an ear buddy, which was made by David Galt, who was a very well-known still is a very well-known plastic surgeon specializing in ears. And the ear buddy was a thing that you would put on, but it really needs people like midwives and people like that to be kind of aware of it. It's quite a difficult subject, I would imagine, to bring up with a newborn, but the sooner you put it on, the better, because as soon as you start getting old, even with a year or so, the cartilage becomes a lot more firm and is not able to be molded with the ear buddy. So we don't do it simply because it's only really appropriate for newborns. So that's why it's not really effective in adults. Adults can't really correct a prominent ear without surgery. So that's why we don't do it, but it is a thing. Why can't you remove a scar completely? Yeah, I do see people. I saw someone today who was like, but the scar will go, won't it? It's like, well, no. Scars don't go. Scars don't disappear. People think scars go because they fade, and they often fade really well, and that means that people often think that they will disappear, but they don't ever disappear. They will always be there, although they fade. They do fade over time, and sometimes they fade to the extent that you can't see them, but they're there. They are there. If you kind of microscopically, sometimes you really cannot see them with a naked eye. I think I pressed the button a bit late on the Instagram. It's only just come on. Oh dear, it's only just come on. Okay, sorry Instagram, pressed the button late. Don't worry, I haven't missed much. So yeah, so no one can remove a scar completely. So I think I've got written somewhere scar removal on my website or something, but it shouldn't really say scar removal. We should be really talking about scar revision, because that is something we can do. We can revise scars, but we can't remove scars. So once a scar is there, that is permanent. Again, going back to the incisionless non-incision pinnaplasty, in babies, or at least in fetuses, they do heal without scars. But as soon as you get into the world, you will form a scar. So a lot of the work that we do is aimed at minimizing those scars, and we will do everything we can to minimize the scar, but no one will be able to do surgery without a scar, and no one will be able to remove your scar. All we can do is try and make your scar better, simply because that scar, that skin has been damaged and has repaired, and so the repair of skin is not complete. It doesn't kind of look like normal skin. It looks like a scar, but as I say, they often fade so well and they blend so well that it can be very hard to see them. But as I say, on a microscopic level they'll be there, and hopefully it will only be on a microscopic level that you can see it. So if you can't see it with the eye, then great. I suppose to all intents and purposes you could say that they haven't left the scar, but you know, the fact is that they have. But a lot of people say, oh yeah, we left the scar. But yeah, has that kind of answered the question? I'll move on anyway. Why do I need to see an ophthalmologist to remove a cyst on my eyelid? Yeah, okay, this was a patient that Amy showed me the photo. So I remember previously saying we could remove cysts from any part of the body, and then started thinking of areas where we couldn't remove cysts. So that was a foolish thing to say. And yeah, the eyelid is one of them. So sometimes you get these little blocked ducts on your eyelids, like right on the eyelid, on kind of where the lash is, called a meibomian cyst. You can also get styes, and we don't really treat that. That's more of an ophthalmologist. They use little probes and all sorts. I don't know what they do, to be honest with you. But we kind of cut out cysts. So, you know, we can cut out a cyst on the eyelid if you have a cyst on your on the lid, or, you know, we do operate on eyelids. We do, you know, certainly skin cancers and what have you are not uncommon on eyelids. So it's not uncommon for us to do operations on eyelids and to remove cysts and moles and all sorts. But if you've got one of these particular types of cysts, like a meibomian cyst or a stye, then we would suggest you see an ophthalmologist. So as ever, always best to send us a photo. We'll have a look and say, look, that's probably best to be treated by an ophthalmologist rather than a plastic surgeon. So it's certain types of cysts on eyes are best treated with ophthalmologists rather than doctors. Rather than plastic surgeons. They are doctors, of course. Oh, what's going on here? Something on here. Oh, Jojo Logue, you've requested to be in the video. I'm going to assume that's a misclick. Oh God, because if I press yes, then I'll appear in your living room. So I don't know, if you want that, then I can. I'm happy to press yes, but in my experience, it's always a misclick. No one ever wants to be on the live video, but if it's not, then let me know and you can be in the live video. I still have a bit of company, to be honest, but yeah, I suspect it. Yeah, there you go. Oh, see, another misclick. No one wants to be on the video. Also, do you remove cherry angiomas? Yes, we do remove cherry angiomas. So cherry angiomas are anginomas. Cherry angiomas are little blood blisters kind of thing, little blood vessels, and we can absolutely definitely remove those, and no problem at all. Very happy to remove those. Do we offer mole removal with CryoPen therapy? First thing I'd say is that a thing, mole removal with CryoPen therapy? And I guess me saying that kind of answers the question, because the answer is no, we don't remove mole with CryoPen. Well, I suppose CryoPen is like obviously, isn't it? I don't know what CryoPen therapy is, to be honest, but I'm guessing it's cryotherapy. I think we can all agree that's a pretty safe guess to say it's cryotherapy. So we don't do cryotherapy for moles, but cryotherapy is appropriate for certain moles. Certainly things like seborrheic keratoses, quite superficial, non kind of cancerous lesions, some skin tags maybe. So Cryotherapy is liquid nitrogen, and the way I know it is on a thing like bit like a soda stream, bit like those cream, those things that squirt the cream. So that's the liquid nitrogen I know. Is CryoPen liquid nitrogen? I don't know what CryoPen is, to be honest. I'm sorry, but if it is some kind of cryotherapy, it may well be relevant for smaller, more superficial, non-cancerous moles, but it's not something we do. So we don't do cryotherapy and we don't do CryoPen. But as I say, that might be an option. And if you send us a photo, certainly happy to advise you on that. And if you if you want to try some kind of cryo treatment, then that might well work and will have the benefit of having less scarring if it does work, because I'm assuming it's going to be quite a superficial treatment. The risk of a superficial treatment is there's still some lesion left behind, but you can't have everything. You either have a superficial treatment with less scarring, or you have a deeper treatment with more scarring, but the superficial treatment is more likely to leave some of the lesion behind. The deeper treatment is more likely to remove the lesion completely, and obviously you're there to remove the lesion. So it's damned if you do, damned if you don't. The idea is to get a perfect amount of depth of removal, which gives a minimal scar and maximum lesion removal. But sometimes we don't get there first time, but I guess it's always best to err on the side of caution. So if it is a superficial benign thing, I guess it's kind of better to start with a less invasive stuff first, like cryotherapy, and if that gets rid of it, happy days. And if it doesn't, well, then maybe you want to move on to other stuff, like surgery. What is the recovery time following a lipoma removal of the cheek? I think this is probably asked because I did a lipoma removal of the cheek today, or at least we thought it was a lipoma removal. It wasn't a lipoma, but never mind. The answer is similar. So it's quite specific, lipoma removal of the cheek. But anyway, we'll go with it. So there'll be stitches in. So when I do stitches on the face, I use non-dissolvable sutures, which need to be removed. So usually a week later. 5 to 7 days is kind of normal. For facial stitches, we normally do it a week later to take the stitches out. In that week, you're going to want to take it a bit easy. You're not going to, if you do an office-based job, you should be fine to go back to an office-based job. If you work on a building site or somewhere dirty and dusty, you're probably giving yourself a few days away from that. Maybe if you can work in the office or something, we can certainly give you some tape to cover it. But you don't really want to get sort of dirty dust and what have you while it's healing. Skin should be healed in about 4 days. So after that, you should be able to get into, those sorts of environments. During that time, you should be able to wash and shower normally. This is kind of my regime. People have different regimes, but if you with me, you can wash and shower from day 1 or day 0. You can wash and shower the same day of the surgery if you want. Just kind of dab it dry. Your bad things are bending, stooping, putting your head down, lifting up, straining. Going to make your face go red, and it's going to sort of bleed. So you don't want to sort of do any weightlifting or anything like that. Any boxing. I know it sounds obvious. You know who you are. We had a patient who had scar erosion on the nose and then went and boxed that weekend, and they got hit in the face, not surprisingly, and the scar opened up. So, not great to be doing that sort of thing. Till the scar's, I'd say 6-8 weeks, really, probably a couple of months before you want to do anything too crazy that you might get sort of contact on your face. But yeah, as I say, a normal sedentary job, you go back to straight away as long as you're not lifting heavy boxes and things. In terms of the gym, you don't really want to get too hot and sweaty for the first week or so. After the first week or so, you can start doing stuff, except avoiding bending, stooping, face going red, so weightlifting and things like that. So maybe lower body stuff, and gently getting into things and then building it up. That's what I would say. That's what I did say. That's my view on that. And so that's me done. I'll be honest with you, in more ways than one. Anyone got a question? They can. Well, I'll go in a minute. Well, I wouldn't if you had a question, but if you haven't, I will, because obviously I've got a lot on. Look after yourselves. Take it easy. Don't work too hard. And I will. I'll be back. You know, don't you worry. I'll be back next week. What's this? Oh, yeah, hold on a minute. Jojo has got a look at that. Jojo, good on you. Good on you, girl. How easy is it to remove a nevus just below the eyebrow? Now, Jojo, how easy is it? Right, easy. None of this stuff's easy, my friend. Okay, years of experience, years of manual dexterity training, but yes, pretty easy, to be honest with you. The main thing is about the nevus. Most nevi, should we say, are quite small, so the size is important, because particularly if it's the lower eyelid, so you've got less spare skin on your lower eyelid than your upper eyelid, so you've got to be a little bit careful kind of pulling your eyelid down. But I've got to be honest with you, I'm egging it a bit, because I'm talking more about skin cancers and things when you have to take a rim of normal skin that you worry about doing that, which is called an extropion. So you end up your tears flowing down your face. So you've got to be a bit careful taking too much skin out of the lower eyelid. But most nevi are relatively small and we'd have no problem. I mean, the skin is quite fragile, quite thin. I did one the other day right up here in the upper eyelid, right by the nose, in the what we call the medial canthus, and it's tricky, no question about it, because the patient's awake and you're messing with their eyelid and all sorts. But it's fine. Yeah, absolutely fine. But the answer always is, Joe, that you should send us a photo, because if it's a big one, you know, if you've got a big mole in your real eyelid, I might change my tune. But as I say, usually they're sort of normal kind of mole sized things are absolutely fine. You're not going to be pulling the eyelid down, and actually scars really well in that area if we can try and hide the scar relatively well. So yeah, I would say, Joe, that would be a relatively straightforward thing for the likes of us in the clinic. But as I say, send us a photo, because I might change my tune if it's some massive thing. Haley, what you got? I know it's been a while, but my daughter's nevus that you looked at on her lip, could she have a shave excision so her lip isn't left pulled to the side, as it's still really bothering her still? Now, Haley, if I recall rightly, which I may not recall, I think she's got like a brown one. It's brown, isn't it? It's like a so if it's a brown, so if you've got like for instance, a fleshy coloured nevus on your face, yes, by all means you can shave it, because that gives less scarring and doesn't take any tissue away. But I think this is like a brown nevus. I can't quite remember, on the lip somewhere. So that nevus is not, it's not really suitable for a shave excision. First of all, the lip bleeds a lot. And the thing about a shave excision is you don't do a full thickness excision. So there is skin that's proud of the skin, if that makes sense. So there's skin left behind underneath, therefore it heals without much scarring, but it heals kind of from the base, because there's skin left at the base. With this one on the lip, if you try and do a shave excision, as I recall of it, it wasn't a thing sticking out. It's just like the lip is quite sort of, is a bit sort of prominent because of the nevus. If you try and shave it, I think you're going to end up shaving full thickness skin, and you're going to be left with kind of like a wound then. And then then what you're going to do? You can't just put a bit of calcium down on like we normally do for shave excisions. You've got a wound there, which you might as well stitch up, because you're not going to leave it to heal on its own, because it'll all contract in and it will be it'll take ages, and it's just on your lip. It's going to be a nightmare. So it's not really a like a nevus, like a raised a mole. I think it's the whole thing, as I recall. I might be recalling incorrectly here. So I don't know if you want to just message me or here. What is this? This is on Instagram. Yeah, message me or something, or I'll try and remember to have a look at your photos to see if I've got this right. But I don't think it was suitable for a shave excision. Otherwise, that would have been a definitely good thing to do, because I know we had long conversations about the filter, the middle bit of the lip being moved across, and all sorts, and the sort of the sequelae of having a large portion of the lip removed, and I completely understand that you don't want that, and I completely understand why on paper a shave sounds better, but it's not suitable. Otherwise, I would have definitely suggested it. And been more than happy to do it, but I don't think you can shave it. You're going to end up shaving the skin of the lip, and that's not what you do with a shave excision. A shave excision is for like localized moles that stick out. You just take the top of the mole off, and then there's sort of normal skin underneath. But this one wouldn't be that. Not sure if I explained that very well, Haley, but as I recall, it wasn't suitable. So it's a really tricky one, and it's kind of like one of those ones, you're damned if you do, damned if you don't. She doesn't like the look of it, so they're going to remove it, but she's worried about what it's going to look like when you remove it, and what if it's worse? Well, then you're going to wish you hadn't removed it. I mean, what do you do? What's the answer? There isn't one, really. The only thing, and I've probably said this to you before, is that if you don't remove it, you got an option. You got options now. Basically remove it or not remove it. I don't know how many other options you've got apart from those two, but at least you've got two options. Whereas if you remove it and you don't like the scar, or you don't like the way the lip looks, there's going to be limited what you can do. I'm not sure what, depending on what the problem is, there might be something you can do, but you can't kind of put it back again, sort of thing. It's going to be it's going to be one of those ones where you've got to just try and give it time, and by time I mean well, at least 3 months, 6-12 months, really, for it to really properly settle. So, it does take time for it to really properly settle. And get other opinions, Haley. I don't know if you have got other opinions, because it's a difficult one. Sometimes people's kind of, we know, I mean, not so much with kind of moles and stuff, but certainly with, with the breast stuff and things that do the cosmetic-y sort of stuff. I think sometimes people feel a bit guilty when they have other opinions, and they like, but certainly with difficult cases, I think it's really good to get another opinion. And I'm like, I welcome it. I'm like, yeah, what do they say? What do they say? Like, what do they think? I'm really interested to hear. I think we a lot of stuff there isn't an answer to, and it's just, especially difficult problems, it's quite helpful to have someone else say, oh, what about that? I'm like, oh, I hadn't thought of that. Yeah, give that a go. So not give that a go, because it's your loved one, but I think having other opinions is not a bad thing. But I think for me, I think my preferred option was excision, not shave excision. Thanks for asking a question. That's good. Nice to have a question asked. And you, Joe. I know you asked a question as well. So, yeah, I'll be back in the place to be on next. Oh, hold on a minute. Is it half term next week? I think it is. I don't know if I'll be back. I might be back. It's 2 weeks half term. I might be back. Who knows? No one knows. I might be back next week. Maybe the week after. Maybe the week after that. But I'll definitely be back. So you got any questions? Save them up. Ask me, and I'll see you on Tuesday in the not too distant future. I'm looking at the Instagram, but of course Facebook's there as well. Thanks for your questions.